Good morning, everyone. We'll just let you know that we're going to start in a few minutes as people come along, so just hang on tight. Thank you, guys. All right, good morning, everyone. Thank you for attending September's webinar. This topic is going to be on dental data and Encounter Data Quality Initiative, also known as EDQI. I'd like to introduce myself. I am Alvin Batista. I will be your moderator for this webinar for September. Today's agenda, we'll cover several items, starting with dental managed care data. We have 274 dental data quality monitoring plans. Also, we'll be talking about Encounter Data Quality Initiative, also known as EDQI. We have a presentation on HIPAA mandated standards, implementation, and companion guides that will be focusing more on 274 and 837 dental data and communication and resources. Joining me today for the presenters, we have Kelsey Hovey, Sarah Rivera, Deborah Dixon, Christine Fessler, and Jeff Jennings. And support staff will be myself, Amy, Abby, May, Shaoyan, and Sue. For the question and answer session, for all general questions, please submit your question to the WebEx chat, and please ensure that your questions are visible to all participants as opposed to sending a private chat to the host. For specific questions, please reach out to your data mailbox as will be instructed. Before we move on, we just want to remind you that today's webinar will be recorded. The recording video, script, and presentation materials will be uploaded to the Quality Webinar Series, ca.gov, in a short amount of time. As soon as it's uploaded, we will let everybody know. All right, so first up presenter will be Dental Managed Care Data. Representing that organization is Kelsey Hovey, Medi-Cal Dental Services Division. She's the Program Evaluation and Reporting Unit Chief. So I'm handing it over to Kelsey.
Hi, thank you. Okay, we will kick it off with the Dental Managed Care DMC data for the overview. Next slide. Are we able to go to the next? There, thank you. So in Medi-Cal Dental, services are delivered through our fee-for-service, and then we have our dental managed care DMC plans in both Sacramento and Los Angeles County. In Sacramento County, or GMC, there's mandatory enrollment, and in Los Angeles County or PHP, it's optional enrollment. And then we have our other managed care plans as well. We have Health Plan of San Mateo, or HPSM, which began in 2022. Programs for all-inclusive care for the elderly, or PACE, and Senior Care Action Network, or SCAN plans, also delivering dental services. Next, we will go into our dental data requirements. So the dental managed care boilerplate contract mandates the plans to collect and report on claims paid and encounters reported. This dental data is used by DHCS to monitor the plans for parity, network adequacy, and utilization, and provides guidance on policy and procedure development. We also have all plan letters, or APLs. And these are the means by which DHCS conveys Medi-Cal managed care information or interpretation of changes in policy or procedures at the federal or state levels, and provides instruction to contractors on how to implement these changes on an operational basis. So APL 15-007 mandates transition to post-adjudication claims and encounter data systems, or PACEs. APL 18-011 mandates the use of the Encounter Data Submission Reconciliation Form, or the EDSRF. And finally, we have APL 19-004, which mandates transition to the electronic X12 standard format for submission of provider network data. And lastly, the companion guides contain instructions and other information for the electronic communications and submissions, and this will be touched on a bit later and more in depth in the webinar. So next, we'll move to the dental data submission frequency. The Dental 274 is an electronic standardized file layout and protocol used to submit provider network data to DHCS. The data is used for network adequacy assessments, data analytics, and other federal and state reporting requirements. The 834 file is a benefit enrollment and maintenance file, which provides member enrollment information such as new enrollments, changes in enrollments, reinstatement, and disenrollment. And further, the 837D is used to transmit claims data through PACEs. And these files are submitted between the 1st and 10th of every month. The EDSRF is due by the 15th of the month following the month of submission to PACEs. So for example, for the January data, the EDSRF would be due February 15th. And then next we'll go to the dental data submission goals. So in addition to the 274 and 834 files, plans also currently submit monthly, quarterly, and annual deliverables to us, which provides DHCS with a variety of data that is utilized to create reports and fact sheets that help determine the effectiveness of the Medi-Cal dental program and how it can be improved. Some of these deliverables and data include call center data, case management numbers, grievance and appeals, linguistic services, performance measures, Proposition 56 payment data, provider training and monitoring data, utilization data, treatment authorization request or CHAR data, and time and distance data, and finally the provider network report, or PNR. With regards to the PNR, Dental is currently reviewing the 274 file for quality and reconciling that data with the PNR that's currently being received. And looking forward, Dental aims to transition plans from submitting both files to only submitting the 274 file. And we will reach out to plans in the coming time. And with that concludes the Medi-Cal dental, DMC dental portion. Thank you.
Thank you, Kelsey, for that presentation. So up next, our next topic will be 274 Delta Dental Quality and Monitoring Plans. And to give that presentation will be Sarah Rivera, the 274 Project Manager.
Hi, thank you, Alvin and Kelsey. So I am a project manager. I did help the dental programs on board with the 274 transaction back in 2019 and 2020. And as Kelsey mentioned, one of the goals of the department is to start phasing out the PNR and using the 274 data specifically for ongoing network monitoring and certifications. Go ahead and go to the next slide. So as part of that, we will be looking closer at the 274 data and how it aligns with the PNR. So what we're asking the dental managed care plans to do, and you're probably already doing this, is make sure that each of your monthly submissions, that it includes all of your active and available providers that are authorized to cover dental services. Ensure that all those providers are on your monthly submissions and are represented so each monthly submission is a submission for the previous reporting month. So ensure for that reporting month that all your active providers are included. For the second bullet, ensure that all the providers that you report on your monthly PNR are also included on your 274 file, so that when we start doing that alignment, that we can validate that those providers those are in alignment, and will work with the plans if we see any gaps. For the third bullet, ensure that all the required and situational data elements are reported in the 274 according to the 274 Dental Companion Guide. So if you see that it's required or situational, make sure you're following those rules. Next slide. Ensure, as Kelsey had mentioned, ensure that each 274 file is submitted and accepted between the 1st and the 10th of each month for the previous reporting period. So we recommend that you submit your files early in this 10-day window so that if there are any errors, you have time to correct and resubmit. On the third bullet, please ensure that when you submit your 274 transaction, that you're looking at the validation response file that is returned to you in your SFTP folder. Make sure that it shows that the file was accepted. Many times plans don't look at this and the file was rejected, but they assume that it was processed. So make sure you're looking at that file and resolving any errors that are identified in this report. Any file that is submitted after the 10th is considered non-compliant, and the department may take action for late submissions. Next slide. So starting as early as October, DHCS has started a work group, and part of the activities that we'll be doing is, as Kelsey had mentioned, comparing the data that's submitted on the PNR to the data submitted on the 274. And if we see that there's differences, we'll communicate with the plans to make sure that they're in alignment. We'll also be looking at the data elements that are on the PNR, comparing to the 274. If we see that there's data elements on the PNR that are not on the 274, we'll be looking to update the companion guide to make sure that they're in alignment. We'll also be making sure that all critical data elements that are needed for annual network certifications and ongoing monitoring are on the 274. So there may be some updates coming in the near future on the 274 companion guide to align with the department needs. Next slide. So once we go through that period of assessing and comparing the 274 to the PNR, and if we've identified any gaps, then we will establish a timeline and working close with the plans to determine what are those changes, what changes does DHCS need to make for our system and the companion guide, and what changes do the plans need to make for this alignment. But we'll keep you through the dental all plan meetings and communications. We'll keep you informed of upcoming activities and timelines. And with that, I did want to say one thing. We don't have specific dates at this time, but we will let you know as soon as we have some timeframes.
Hey, thank you, Sarah, for that presentation. Next topic will be Encounter Data Quality Improvement Initiative, also known as the EDQI. And giving that presentation is Deborah Dixon, Data Quality Branch Chief.
Thank you. Can you hear me? I have some really weird auditory things going on, and so I'm good.
Yeah, I think we can hear you. It's a little tinny, but I think you're clear, Deb. So
Okay. Yeah,
that's
I've
good.
got some.
That's much better. Yeah.
I got some kind of background thing going on or whatever. But as long as you can hear me, that's great. Okay. So good morning, all. My name is Deborah Dixon with the Health Information Management Division in the Data Quality Branch. So we've been talking for a while about a new Encounter Data Improvement Initiative based on encounter data quality findings from our federal partner. When we started this series in April of 2023, for those who have been around, we mentioned the TMSIS quality measures, the Medicaid scorecard, and federal reporting requirements. So today we'll be talking about performance measures that meet those requirements, which you're going to hear about in a few minutes. Okay, so here's the importance of encounter data to DHCS. I mean, this isn't, I think, news to folks, and it's not something new. However, we do have a new focus on the encounter data based on the federal requirements. So as you know, plans are required to submit high quality encounter data on their members. We use that data here at DHCS for our, you can see a variety of uses there, whether it's program oversight, rate setting, audits, federal reporting, a whole host of activities. The quality data is used to report. And then we take that data, meaning DHCS, and provide that data to our federal partners, CMS. So it's important for us to know all of the services the members have received, the different areas and such, like population groups, the geographic locations, the providers that perform those services, etc. And then we in turn provide that data to CMS. They provide us a report of our data quality errors that need to be corrected after receiving the data that we have sent to them. So that's the TMSIS effort that I just mentioned, the Transformed Medicaid Statistical Information System. TMSIS requirements are what our federal partners hold us accountable for in terms of data quality. So next slide, please. So now we've got this encounter data improvement effort underway. And as you can see here, it's a multi-pronged type approach where we're doing a variety of things. First, we're going to refresh the program goals and the strategy to help us with that oversight and accountability. We're updating our expectations and documentation and reporting processes to align with those TMSIS requirements. We've expanded and reorganized a dedicated team to maintain those reports that go to CMS and to provide some technical assistance. As you can see with the next bullet, we are in the midst of developing a program that will connect targeted providers with technical vendors to help address those persistent encounter data reporting issues that our federal partners are finding on their side for us to correct. We also want to use this program to improve our coordination and communication with plans to help us partner together to meet those requirements from our federal partner CMS. So for today, what we're going to focus on is the update of the reports that are used to assess the data quality that comes from the plans. And again, we're talking just the medical managed care plans. This should be familiar to you. The QMed, the quality measures for encounter data report that you're currently receiving. Next slide, please. So we've mentioned that QMed report in the past, and as part of our partnership to meet the requirements with CMS, we want to do a survey to get some feedback on these QMed scorecards. Next slide, please. So here is this survey will be sent out separately. However, we wanted to give you a sneak peek, so to speak, so you could take a look at this in case you need to get back internally and talk to some of your folks. Be ready for that scorecard information that would help us in developing some of the new requirements. So as you can see here, how are you using those scorecards to drive your data quality improvement? What challenges do you experience, if any, using that scorecard? Do you have any feedback on what you would like to see in the QMED measures and the scorecard development and distribution process? And what guidance would you find useful to support the new QMED 2.0 refresh that's coming? Meaning, how would you like to work in partnership with us, whether it's webinars like we're doing now, doing some office hours, some targeted types of meetings and such, written documentation? What would you find most useful in being able to support the refresh of the QMED report? We do have an email address, as you see here, if you've got some feedback you want to give us now. But at this time, we will be sending that out separately. We just wanted you to be able to see and think about, and especially today, as we have Christine talk about this QMED refresh, keep those questions in the back of your mind as she goes through where we are today and how this QMED works, a look at the CMS requirements, and some thoughts about the refresh of the measures, the scope, and the processes for the QMED 2.0 refresh. So I'll hand it over to Christine.
Thank you, Debbie. Hopefully you can all hear me okay. All right, so let's go to the next slide, please. All right, so just to do a little bit of refresh on the QMED, the program and purpose in the background. So it was initially rolled out in 2015, and following with federal reporting requirements, it was developed as a standardized and quantitative approach to assess the quality of encounter data submitted to DHCS by medical managed care plans. So the most recent update that was done was in April 2014 in order to address the pharmacy carve out from medical managed care. Obviously, the scores prior to that carve out or recalibration were not accurate for the scoring until it was recalibrated to take out the pharmacy as part of the scoring. So again, it's the QMED is comprehensive. There are 8 threshold measures for which the encounter data is compared and scored, looking at whether or not the data is above or below a data quality target. It is comprehensive in the fact that if a managed care plan has more than one HCP, each of the HCP is scored individually based on the various data quality dimensions such as timeliness, completeness, reasonability, and timeliness. So it's also complex. The aggregation method of the various data quality dimensions is a bit complex. There's a lot of steps in looking at the thresholds for each of the measures, and then resulting in a final kind of quarterly encounter data quality grade. So we do have an example here in a little screenshot. This would be like the cover page of what a managed care plan would receive on a quarterly basis. Again, we're looking at, based on the different dimensions here, completeness, reasonability, and timeliness, whether or not it's considered low performing, unacceptable, and then of course the grades there over the various quarters. So let's go ahead and go to the next slide, please. All right, so we've been talking about the QMED refresh. This has been in the works for some time in order to align with the federal reporting requirements that impact how states are scored on encounter data quality, that we submit to CMS. So for California and DHCS, this means updating the scope of the QMED measures to be in line with the new federal reporting requirements and in order to cover the high priority TMSIS issues that Debbie had mentioned earlier. Of course, this also means there are new CalAIM related programs and reporting requirements for the enhanced care management and community support, the focus on outcome-based assessment methodology, focusing on improving health equity. the QMed refresh also incorporates amendments to the MCP contract requirements around reporting encounter data arising from new ECM CS services rendered to beneficiary. For instance, there are about 14 new community support services to help capture and address the social drivers of health. So that's just a brief overview of what we're looking at for the QMed refresh. And if we could go to the next slide, please. I think this would give a little bit more of a salient example of how CMS is using managed care encounter payments data to score each state on its data quality. So as you can see, for CMS, California does have room to improve. You know, from the DHCS perspective, we're really looking at the QMed refresh as an opportunity to further collaboration with with the managed care plans to align on the CMS requirements. You know, we're all in this together. The data that we receive and we report is scored, so we have an opportunity to really be able to improve the data together as a team. Again, so the QMed 2.0 will cover the high priority TMSIS issues as well as, you know, the state contracts that I mentioned earlier and the business needs of DHCS. So in the next slide, we'll go into a bit more detail of what that means. So here for QMed 2.0, we're looking at how are we going to kind of address some aspects of the QMed report. By topic, we're looking at measures. We're going to look at a change in scope and then a change in the process. So for example, going to the measures, again, we're looking at kind of three main things: TMSIS issues, the business needs, and contract related. So for example, the TMSIS issue that will be new is looking at kind of like the prior slide is payments. So looking more at encounters with non-zero paid amounts, or the paid amounts is less than the allowed amount. We're also looking at the completeness of 274 reporting as compared to NPIs on encounters. And then as far as the business needs here at DHCS, we need to focus on the uncorrected denied encounters, which includes duplicates, which has an impact to capitated rate development. And then again, specifically kind of on the contract related, we're looking at the timely submission following payment, and then also looking at the timeliness of providers. So measuring the provider timely submission of encounters to plans and the plan's timely payment to providers. So that's as far as kind of the initial high priority measures we're looking at to as part of the QMed refresh. Another thing is the scope. So as Debbie had mentioned, and we've discussed that currently DHCS Data Quality Reporting Unit is sending the QMed reports to managed care plans. Going forward, we're hoping to expand and looking to expand that to all comprehensive plans, special plans, the PIHPs and PAHPs. So we are looking to be able to develop something and send that out in the future. And again, last thing here on the process, as I said, right now, the QMed, the way the scoring, it's relatively complex. There's a lot of different aggregating of the underlying thresholds that occur. There's the quarterly dimensional rate, which goes into quarterly average rate, and then into the final encounter data quality grade received on the cover page of the report card. So going forward, we're looking at to kind of disaggregate some of the measures so that plans can interpret and view the performance a little easier. It's a bit more salient. Also looking at how each score might impact, how the impact of each measure impacts the overall score. So plans know more specifically what to focus on to improve their data quality. And then also we'd like to be able to compare against peers. So where does Plan A compare to Plan B? So we're hoping that would add salient information for plans as well, helpful information to improve the data quality. So I believe we're at the end here of the QMed 2.0. So I will turn it over to Jeff Jennings, and I will keep my eye on the chat to see if I can answer any questions that pop up. So thank you very much for your time and attention.
Great. Thanks, Christine. Lots of good information there. A lot to digest. This section really is kind of the standard information I've been sharing for the last few months in the webinar. We like to include it to just reinforce. So why don't we go on to the next slide? So briefly, you hear a lot about the 274, the 837, and other numbered transactions. Oh, people can't hear me, I'm being told. I believe I'm off mute. I will try to shout.
I can hear you, Jeff.
Oh, okay. Lisa, not so sure what to do. So, okay, back to the being on a roll here. So for those of you that aren't as familiar with some of these transactions, under HIPAA law, certain data sets of administrative healthcare that are related to administrative healthcare are mandated to be exchanged by payers and trading partners using specific standards. And I'm sure most of you are familiar with the 837 transaction. That's used for claims when a provider or plan is billing DHCS, or it's used for an encounter when the payment model is different, such as capitation, and a trading partner is reporting encounter information. So same standard use for both. And I just reference here some of the HIPAA law and the standards organizations such as X12, which develops and maintains the 837, and the 274. Next slide. Thank you. So as I mentioned, X12 is the organization that produces these. Now, in order to understand completely each transaction and specifically how DHCS wants to use the transaction, it's important for trading partners to be able to reference both the implementation guides and the companion guides. Implementation guides are produced by X12 and owned by X12. They are the complete guide to any data standard transaction, such as the 837 or the 274. The companion guides are produced by each individual payer, such as DHCS. We produce a companion guide, which takes data elements within those transactions in which we are allowed to customize the values that we are requesting. We communicate that customization in the companion guides. Next slide. So as I was just mentioning to you, the IGs are the complete guide. The companion guides are a shorter customization guide. Implementation guides are used in combination to understand the complete transaction. And one thing I wanted to touch on, the 274 implementation guide can be a little difficult to obtain because it's an older standard. If you are running into any issues obtaining that guide, please let me know. You can email the data exchange mailbox, probably the best way to get a hold of me. And thank you. Next slide. Will help you obtain those. X12 now uses an online viewing tool rather than a PDF, unfortunately. Sometimes PDFs are available on request. If not, once you make your arrangement with X12, you'll be given access to the viewer. That's where you can look at pretty much any implementation guide. If you need DHCS specific companion guides, we publish those to our DHCS documentation center. Access is granted upon request. So if you need access, please contact the data exchange mailbox, request access, and we'll help you out. In some cases, access may not be available for your organization. We are working on alternatives to share items with you. If that's the case, again, please contact Data Exchange mailbox and we'll make sure to get you the artifacts that you're looking for. I believe that's about it. Why don't we go to the next slide? Questions? Yes. And I believe this means overall questions.
Yes, thank you, Jeff, for the presentation. So before we open it up for more questions, just want to go into the chat and see if there's any questions that have not been answered. I know I've seen people answering the chat, so thank you very much. First question so far from Oleg. In this webinar, Stephen Lefebvre precisely described dealing with, let's see here, dealing with duplicate managed care claims. Does this also apply to dental claims as well? Yes, hearing not. So if their questions are not answered today, go ahead and put it in the MCDS mailbox, or we can also answer it later on. Sorry, go ahead, Jeff.
I was going to say, I'll jump in. I don't want to speak for Stephen, but more precise information can be shared via email, and there might be slightly different logic for dental, but that would be explained in the dental companion guides. So I am looking at that question. I believe it was about the 837 claims and encounters. My suggestion would be consult the dental 837 companion guide. And I don't know at this time, our dental staff might be able to answer this if the same duplication logic is applied to Delta dental claims. Those are fee for service, are processed through an entirely different system. So hard to say, but we can follow up.
Okay, we have a question from Valentin Felix Jr. To clarify, 274 files are submitted by health plans. Let's see, what else do we have here? Not by health service centers. Also, do 274 or the PNR files include quality data, for example, fluoride application percentage?
Hi, this is Sarah. I can't speak to the PNR, but for the 274 submissions, they are submitted by the dental managed care plans that are contracted to the state of California. And it would include all the providers that are within their network.
Hi, this is Kelsey. Yeah, for the PNR, it still only reports provider data, so no like utilization data, for example.
Okay, I see we have a question from Esquio Casillas. I think this one was answered already. Let's see what else is there. Also, there was a question from Ann Bence. I believe that one was answered as well. Thank you, Debbie, for responding. Going to the chats. A lot of we can hear yous. Let's see what else.
I mean, I'm a shouter, so I was kind of surprised nobody could hear me.
Let's see here. Oh, we have a question from Leonard Versosa. What is the timeline for the rollout of QMed 2.0?
So this is Debbie. So QMed 2.0, we're currently working on the development of the program and all of its associated requirements and such, and doing some analysis. So it'll be sometime in 2025. I don't have an exact date yet. It's not something that's pending soon, if that's what you're concerned about. But yeah, we will be, once we get a little more detail and we bring that back to this group, then we'll have some timelines and associated requirements and such. So not immediately imminent, but we're looking at 2025.
Cool. All right, we have another response from Esquio Casillas. Thank you for the update. One consideration for PACE programs in terms of dual PACE members. We are currently working to fully submit all encounters of all aspects of care, medical, dental, specialist, day center, IDT, disciplines, transportation, etc. Let's see, part of the question. to both CMS and DHCS. We are approaching full duplication of encounter data reporting. Is there any plans to minimize the duplication of encounter data reporting to dual members?
Hello. I had myself double muted, so sorry, Debbie. Thank you for jumping in there, but I did put some responses in chat. So I think that as far as duplicate encounters, there's another issue. The PACES team that manages and creates the edits for when files are submitted to the DHCS PACES SFTP site. So there's an edit that's been in the works to look at duplicates at the service line. That's still ongoing, so that would help to address that. There was a recent effort. We send out some data to some of the PACE organizations, requesting them to look at kind of a new edit that the PACES team had put in specifically for duals, and trying to understand why maybe there was some missing information. So I think, this is something that we continue to look at on how to address the duplication of encounter data. So if a more detailed response is requested, I can get back to you regarding something more specifically.
And Christine, I noticed the question was also about dual members, like, such as those enrolled in DSNP plans and that kind of thing. Did you touch on that just now? Can't remember.
Yeah, that was there was a survey that the PACES production team requested data quality reporting unit to reach out to some of the PACE organizations regarding like dual. So if there was another payment, if the encounter was denoted as having being dual, but there was missing information in the payment amount. So that is still an ongoing analysis from the PACES team. I haven't heard back on that to see how they'll kind of manage that issue going forward.
Thank you.
Thank you. And then also I see a couple of responses from Christine and Jeff, so thank you very much. And then also May put the link for the documentation center in the group chat.
Okay.
Let's see. There's a question from Erica. We're still not able to submit PACE day center encounters. No staff have license or MPI. Is this negatively impacting?
This is Debbie. I don't know the answer to that. We'll have to work with the program area that manages the PACE plans and contracts. So this is one of those. We'll have to get back to you on it.
Okay, and then I see more responses from our group, so thank you very much. Other than that, does anybody else in the chat or in the presentation would like to ask any questions? Feel free to ask away. Okay, hearing none. As always, if you have any additional questions, please forward them to the appropriate mailboxes. So on to communication, and I see a couple more just came in. Christine, will DHCS send out the Survey Monkey? Later on, we will be able to submit the Survey Monkey. And then another question came in. Are transportation encounters required for first PACE? Debbie will get back to you on that one. So thank you very much. All right, other than that, onto communication and resources. So we have here a listing of all the data group mailboxes. As you see, we have one for 274 medical physical health, 274 behavioral health plans, 274 dental, encounter, behavioral health short dial, PACE, medical managed care policy and APLs, DHCS documentation center access requests, technical questions such as ECM, CS, CCM, and JSON, and MC DSS webinar support. And then if your message is urgent, please mark it urgent in your subject line or in the subject or in the body of the email. As data security reminders per DHCS ISO, as Medi-Cal data contains data related to both federal programs, DHCS data privacy rules specify data related to Medi-Cal beneficiaries cannot be processed, sent, or viewed by entities or individuals outside of the United States. For additional information on the DHCS data policy, please visit the link below. And here we have additional resources for the DHCS quality webinar series page. This is a direct link to the site and the link to follow the path. In this also resource page, we have the webinar series where we will have updates, including today's webinar. Once it's complete and approved, we'll be able to post it on the webinar site. Also, you'll find the recording script, PowerPoint slide deck, upcoming webinar schedule, distribution list, subscription link, as if you want to add or delete certain people, please go to that link. We also have frequently asked questions and glossary available. And I see we have a question from Sanjit. What will be the deadline for ECMCS JSON submissions for phase 3?
I think we're going to have to follow up on that one. I just don't know it off the top of my head, but Sanjot, we'll get back to you right away on that one.
Okay,
I don't think we have the subject matter expert on the webinar for today, but I'll follow up with you shortly. This is Jeff Jennings.
All right, thank you, Jeff. I see there's a question from Jackie Liu. What is the appropriate or approximate timeline for the first QMed 2.0 training webinar?
I am so excited to hear that people are looking forward to a training webinar. I think we are currently like in phase 1. So phase 1 is again focused on the high priority TMSIS issues that we discussed in the QMed refresh section. So we're currently working on the data analysis and investigating thresholds, the quantitative analysis. And then that's going to apply to like probably the PACE organizations, and that won't really happen until probably the second half of 2025, when we would begin to have kind of a more formal QMed documentation to share with our training partners here. So we would probably have the training at that time. But thank you so much for your interest. Appreciate it.
Thank you, Christine. So if we have no additional questions, just want to give you guys a preview for October webinar. So for October, we will focus on 274 managed care data. We'll be doing monthly data checks. The next meeting will be October 30th, 2024, from 10 a.m. to 11:30 p.m. Looks like day before Halloween. It's like a treat for you guys. Or a trick. All right, so if nothing else, we want to thank you so much for you guys' participation. Once again, thank you for all the presenters and staff, and also you, the audience, for participating. Once again, if you have any questions or comments, please submit to the webinar, also in that email. Okay, I was just told there was another question. Oh. Let's see.
I think we're good.
So,
yeah.
So, yeah, thank you so much. And we'll see you guys next month. Signing out. See y'all next month.